Well, today I'm at the always beautiful Daniel Stowe Botanical Garden outside of Charlotte, North Carolina. And I'm going to tell you my story about Bowen therapy, how I became acquainted with it, and what it might do for you. Going down the steps. One afternoon I was interviewing a new patient, and she was telling me about her foot problem, and at the end I said, I think it might be coming from your sciatic nerve. You got any low back problems? And she said, oh no, I had that fixed 2 years ago. She says, this is different. I know what sciatica is like, and this is not like what I had before. And I said, how'd you get it fixed? And she said, I had Bowen treatments. And I said, what's that? And she told me a little bit about it, and I'd had back pain, sciatic nerve problems for about 12 years. And I'd been to chiropractors and acupuncturists and physical therapy, and the pain was getting worse, and I was afraid I was going to have to see the neurosurgeon. So I probed her a little bit about it, and she told me about the gentleman who did the therapy, who's about 10 miles up the hill from me in Sacramento, California. So I made an appointment, and when I get to his house, there's an old lady sitting on the front step smoking a cigarette. Missing a couple front teeth, looked like a bag lady. She said, if you're here to see Milton, you ring the bell. He answers it himself. Well, as it turns out, this guy has an unlisted phone number. He only answers his phone an hour a day between 8 and 9 in the morning. And when I called for an appointment, he was booked up 3 weeks in advance, excepting he had a cancellation that afternoon at 5 o'clock, which I took. So he greets me at the door and takes me back into a bedroom, lays me on a massage table and starts rolling and poking my muscles. And I'm thinking, this is a joke. What's this guy doing? And then after he rolls and pokes a few muscles, he leaves the room. And then he comes back 2 or 3 minutes later and rolls and pokes a couple more muscles, then leaves the room. He didn't explain anything to me. But after about 5 minutes, I started to get very mellow and almost went to sleep. And he turned me over on my back, and he did some stuff down in my lower legs and my neck, and he gets down inside my groin, inside the thigh, and he rolled that muscle. And oh man, I thought I was going to hit the ceiling. And he left the room for one of those little timeouts, and my hands started to sweat. And it was not really perspiration sweat. It was kind of a sticky, carob syrupy kind of substance coming out the palms of my hands. And I could also feel some of it was coming out the soles of my feet, although I still have my socks on. And he came back in the room, and he saw me touching my palm of my hand, and he said, he touched my hand, and he said, ha, toxins coming out. I said, oh yeah, what kind of toxins? And he smelled his fingertips, and he said, it doesn't smell, so it must be lactic acid. So I said, whatever. And so he gets me up off the table, and my pain was gone for the first time in 12 years. My whole right side had tightened up during the course of time, and my back ached, and my groin ached, and my foot was stiff, and my jaw was out, and all that was gone. It was totally loosened. And so over the course of the next week or so, 4 different foot and leg problems cleared up, including hammer toes on my left foot straightened out somewhere between my morning of discovery and the afternoon of the treatment. And when that surfaced, I said, I've got to learn how to do this. So I went up, and he taught classes, and I took a 4-day workshop and started learning how to do the process of Bowen therapy. Went back to my practice and started integrating it in to see where it would fit. And almost every podiatry patient needs Bowen therapy. A lot of people have been favoring their foot pain for months and months and months, and now their hip is painful, their back is painful because of favoring their foot. And I noticed that I didn't have to inject as much cortisone, didn't have to prescribe as many drugs, didn't have to do as many surgeries on my podiatry patients as I did in the years past, because this therapy just absolutely fixed many of their foot problems. Also, in the years past, when I was practicing conventional podiatric medicine and foot surgery, my overall results were about 80% favorable. And when I started incorporating the Bowen technique into my practice, my results went up to about 95%. My patients loved it, and hardly a day went by that a patient wouldn't say something like, oh, Dr. Mosher, I don't know what you did last week, but you changed my life. And another one might say, you wouldn't believe what happened after that treatment last week. Oh my gosh. And then they tell me what happened. And another one would say, gee, I had a runner's high all day after that treatment you gave me last week, and now I feel a sense of peace and balance and well-being. And another one would say, if only the medical doctors would take this holistic, naturopathic approach to our healthcare issues. And last but not least, often people would say, you know, I've been through 5 years of hell. I only wish that I'd met you 5 years ago. My life would have been different. So check it out. Try to find a Bowen therapist in your area. There's a bowendirectory.com, and there's a directory of a number of practitioners geographically located. And check it out, try it out, and see if it doesn't change your life. Have a great day. Thanks.